special series, The Future, with a look at weight loss. Can you imagine if you could lose weight simply by freezing the nerve that tells your brain you want to eat? Effectively retraining your stomach. That means no more diets, no more yo-yoing. Well, it is already happening. Watch this.
Melissa Donovan is no stranger to struggling with food.
Like a lot of women, I'm an emotional eater, and I typically will eat when I go out to celebrate. I will eat when I'm at home and I'm bored, when I'm like, it's really been a stressful day at work. Every diet that ever was, I've done it. A Nutrisystem, Jenny Craig, Weight Watchers. I've tried paleo, Whole30, sugar detox. I've been on the 21-day sugar detox. And I'm a registered nurse, and I've had 2 nutrition classes. When I had my second son in 2011, I've never been back to pre-pregnancy weight, and it's been so frustrating. Why can't I do this? And what's my issue? I now have to realize when I'm hungry and when I'm not hungry, and how to eat better and how to put myself in a place where I'm going to succeed.
And her current secret to success is one you might not have heard of yet: nerve freezing. Emory Hospital started a new trial using cryotherapy for weight loss last summer.
We go through the skin with a needle. We freeze the nerve, shut down the signals in 2 directions, from the stomach to the brain to quiet the hunger response, and out to the stomach to slow food transit through the stomach.
Melissa was Dr. Prologo's first patient.
You feel absolutely nothing. I thought I was there for 2 minutes. I was there for 30. The next day I called Dr. Prologo and I was like, is this a placebo effect? Like, I think I'm supposed to lose weight, so is that why I don't feel hungry? And he started laughing because I was the first one that had it done. This is a tool in my toolbox to help me with losing weight.
Well, that's awesome. Joining us now is Dr. David Prologo, interventional radiologist at Emory Johns Creek Hospital in Georgia, and Melissa Donovan, the first ever patient to undergo cryotherapy for weight loss. Good morning to you both.
Good morning.
Good morning.
So this is crazy, and I love it. You're telling me, so my ex-husband is a pain management doctor, and he used to stick needles in people to dull the end of the nerves to help with their pain. This is the same kind of thing.
This is exactly the same thing. And in fact, that's the origin. We were using cryotherapy to decrease nerve signals to help people with pain. And now we're doing it to manage people's hunger.
It's 1 needle in the belly?
1 needle in the belly to the vagus nerve, at the posterior or the back part of the stomach, a 2-minute freeze, and a Band-Aid over the puncture site.
How long does the freeze last?
So the freeze itself should last 8 to 12 months, but the real hope is that by then, new habits will be ingrained and the person's life will be transformed.
So how, you get the shot, right? And then you say the next day, you're like, is this placebo effect? What changes did you notice?
I forgot to eat. I mean, and I go to bed at night thinking about what I'm going to eat for breakfast the next morning.
I feel like we all do. My whole day is driven by what I'm going to be able
like,
to eat at my next meal.
I have a bagel. I don't know. Like, I'm so excited. And so I, made a cup of coffee. I went to work the next morning, and literally it was like 1 o'clock. Nurses are really busy. We're on the floor. We don't pay attention. I was like, you guys, I haven't eaten today. That's crazy. Yeah.
Now, many people who need to lose weight are emotional eaters. Mm-hmm. Right? Yeah. Food really is, my friend. It's always there for me.
Yeah.
Does this address that? Because that's not like really hunger.
That's what's so interesting, because I always go to food. Celebration, sadness, boredom, go to a movie. I'm thinking about what snacks I'm gonna have. I used to pack snacks in the minivan when I'm out with the kids. I'm always thinking about it. And now I was forced to realize I am an emotional eater. I don't need to be. I have to find other ways. Now I have more time and I'm just not hungry. I'm not grabbing for that food to make me happy. And nurses are the worst. We tell you to eat well, and then we eat donuts at the nurse's station. And so I became very judgy, and I was like, I'm not eating the donut. I'm not hungry. Look at that.
Right. When you eat a meal, do you stop earlier?
You do. And what was my, when I go out with friends for sushi, I overeat sushi bad. Like, I'm like, oh no, give me my 4 rolls. And I was like halfway through 1 roll, and I was like, I just can't finish this. What a waste. You really don't have that desire. You don't have that hunger. You don't have the craving.
How long ago did you have it?
I had it in July.
All right, and she's lost 25 pounds, right? Mm-hmm. And is it true you just recently did a CT scan of Melissa?
We did.
And what did you find?
We were talking about it backstage, actually, and her body fat percentage is down 14%.
So what? Why does only Melissa get it? What about the rest of America?
So certainly we hope to roll this out to the rest of America soon, but the point I'm hoping to make, and Melissa is making, is that the trial is really an effort to create a whole new way of thinking. I want people to shift their focus away from I'm going to lose 90 pounds in 90 days, and on to a brand new target, a new strategy which is aimed solely at not quitting your diet. That's
what do you mean at
role.
not quitting your diet?
So the role here, we have an unlimited supply of diets, right? But the problem is people can't stay on them.
Yep.
Mm-hmm.
And so what we hope to do here is dial down the body's response a little bit to dieting, make it a little bit more comfortable and easy, and give people a chance to succeed.
Now, I know it's early, but is there any other side effects of this that we need to worry about?
So far we've done 20 patients, and the average time out from the procedure is 4 months, and we haven't seen any complications related to the procedure or adverse effects yet.
So it's not like at the 12-month mark or when this completely wears off, she's going to be this voracious eater. It's going to come back double.
No. If anything, we hope that the nerve will regenerate to a normal state and a new set point.
Mm-hmm.
Would you get another one? Get another shot at the end of the 12 months?
I'm probably not going to need it. That's what's so interesting, because I've been on every diet. He's right, it's unlimited. I've done them all. And if I don't lose the weight quick enough, I'd gain it right back. So I've lost 20 and gained 25, lost 15, gained 20. And my friends are always, what diet are you doing today, Melissa? And I was like, it's true. And now, honestly, it's very slow and steady. I'm not to where I want to be yet, but I'm well on the way. Usually by now I would have already gained back.
It's incredible.
Yeah.
Good for you.
You won't need it again, Megyn, sorry.
Yeah. I'll give you the last word, Doc. Go ahead.
You won't need it again because it just sort of lowers the entry barrier for you and keeps you on your diet long enough to gain some momentum. And by the time you've gained momentum, you're on your way and you don't need it again.
This is revolutionary.
Yeah.
Can I just see? I'm just curious. Raise your hand if you would consider having that. Yes, almost everybody. Not everybody, almost. Well, good for you. Thank you for sharing your story, and all the best to you.
Thank you so much.
Thank you, Megyn.
Wow. And for more information on this procedure, go to today.com/Megyn Today. I can feel the website crashing.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.